Hello again, this is Dr. Connors, section 19. You're coming to the close of the book. This section is smaller, the next section is a little longer. So, this section we talk about some common complications that we see when people come to us. Understand, most patients, matter of fact, can't remember a patient that's come to us that just heard they have cancer and they want to do an alternative approach. Just typically doesn't happen, at least not in our office. We get patients that have done chemo, radiation, surgery, are in stage 4, have been given, 2 weeks to 2 months to 5 months to live, have been told to go home and get their affairs in order, and then they call us. It's just the way it goes, and that's okay. So it's a blessing when you see miracles happen, and we see miracles on a pretty regular basis, and that's what keeps us going. So I love it. I'll never change it for a second. There are a lot of complications when you're dealing with, especially with somebody who's done chemo, radiation, and surgery and has kind of fumbled through ways to stimulate an immune response and to help them get through that situation. You go in most chemo wards and they have a refrigerator with refreshments, and it's Gatorade and juice and sweetened milk and Ensure, and that's their idea of nutrition. It's hilarious. I had a patient who was going through chemo that sent me pictures of what they were given as treats. They were given cookies and snack cakes, and to deal with the feeling nauseous of the chemo, they took a picture of the hospital refrigerator of what was open to them as patients, and they could help themselves. It was rather it was rather disgusting, actually, and for that to be pushed by a medical establishment uh, is it's on malpractice. So it's a crazy. So, but there are some things that you can do with serious complications. In this chapter, you'll read about some things that have been helpful with cachexia, that's severe weight loss when a person is deteriorating quickly. Um, and some other frequently asked questions that you'll find in this section. So hopefully this will be helpful for you. All right, I will see you soon with the next section.